The growing Ebola outbreak in Central Africa could surpass 20,000 cases within months if efforts to isolate infected people fail, according to new U.S. health projections. Experts warn the spread of a rare virus strain and ongoing conflicts could fuel a major health crisis. The U.S. Center for Disease Control and Prevention, CDC, has warned that the current Ebola outbreak in Central Africa could grow to more than 20,000 cases, depending on how effectively health authorities identify and isolate infected people. New computer models published by the agency project of a range of outcomes from around 10,000 cases to well over 20,000. In the most severe scenario, the outbreak could approach the scale of the devastating West African epidemic of 2014-2016, which infected more than 28,000 people and claimed over 11,000 lives. Without strong public health interventions, an outbreak of that scale is possible, said Dr. Satish Pilia, who leads the CDC's Ebola response. Experts warn of a dangerous trajectory. Public health specialists say the outbreak is moving in a worrying direction. Jennifer Nuzzo, director of Brown University Pandemic Center, said the modeling confirms concerns that the epidemic will accelerate if stronger containment measures are not implemented. However, she cautioned that projections remain uncertain because of limited data and the difficulty of predicting how outbreaks evolve. Health officials stressed that the figures should be viewed as potential scenarios rather than forecasts. Rare virus complicates response. The outbreak is being driven by the Bundibugyo strain of Ebola, a rare variant for which there is currently no approved vaccine or specific treatment. The disease spreads through direct contact with bodily fluids such as blood, vomit, and semen. Ebola often causes severe fever, vomiting, diarrhea, and internal bleeding, and can be fatal. According to the Africa Centers for Disease Control and Prevention, around 400 confirmed cases and 63 deaths have been reported so far, though experts believe the true number may be higher due to undetected infections. Conflict hinders containment efforts. Health authorities face major challenges in controlling the outbreak because it is unfolding in an area affected by armed conflicts and mass displacement. Fighting between government forces and the M23 rebel group, along with attacks by the Allied Democratic Forces, has disrupted healthcare services and complicated efforts to trace contacts and isolate infected patients. The World Health Organization declared the outbreak a global health emergency in May, highlighting the growing international concern. Isolation rates could determine outcome. CDC modeling suggests the outbreak's trajectory will depend heavily on how many infected individuals can be isolated before transmitting the virus. Under a scenario where only 20% of cases are isolated, simulations indicate more than 20,000 infections and roughly 4,000 deaths could occur within 3 months. Higher isolation rates of 50% to 70% could significantly reduce the total number of cases, potentially keeping infections closer to 10,000. Lessons from past outbreaks. The CDC acknowledged that disease modeling has limitations. During the 2014 West Africa Ebola epidemic, some worst-case projections greatly overestimated the final toll. Still, officials argue that the latest models serve as an important warning of what could happen if containment efforts fail. For now, health agencies are racing to strengthen surveillance, improve case detection, and prevent the outbreak from becoming one of the largest Ebola crises in recent history. The head of the World Health Organization visited Uganda on Monday and praised its efforts to limit the spread of an Ebola outbreak from neighboring Democratic Republic of the Congo. The success rate is managing Ebola in Uganda and has been good. World Health Organization head Tedros Adhanom Ghebreyesus said during a visit to Kampala on Monday. He singled out the government's decision to cancel last week's Martyrs' Day celebrations that normally attract huge crowds from across the region. The system has been very vigilant in detecting cases, and now there are 19 total cases, 15 imported and 4 are, I think, from Uganda who had contact with them. So we're glad to witness that. I think the Uganda is steady, we can see, and Uganda should continue that way. Tedros said Uganda's experience in managing public health emergency has helped keep the case fatality rate to less than 1%. The WHO, who has helped train dozens of health workers for the country's Ebola's response. Daniel Kebayinzi is Director of Public Health at Uganda Ministry of Health. The number of people or health workers who will be needed is a moving target, but we know that we shall be sending batches of 40 teams per time, so those are the ones which are manageable to deploy at a time. And we think Uganda will be setting up about 4 treatment units. We've already set up 2 laboratories along with the border in Moponde and 1 in Arua to help with the testing across the border. The WHO head met Uganda President Yoweri Museveni and said they discussed cross-border collaboration. There is no need for restrictions since they affect the economy, said Tedros. Restrictions don't really help. Addressing the epicenter is the solution. A health worker takes the temperature of the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, in Bunia, Congo, Sunday, May 31st, 2026. Moses Sawasawa, copyright 2026, the AP, all rights reserved. Borders closing. One of the confirmed cases in Uganda was a Congolese citizen who had traveled to the United Arab Emirates before entering Uganda. 2 days later, the UAE announced it was banning entry to travelers arriving from the DRC, Uganda, and South Sudan. In Mauritius, El Express newspaper reported on Monday that the island nation was also barring foreign travelers from the 3 centuries. This is the 17th Ebola outbreak to hit the DRC, a vast and unstable Central African country of more than 100 million people. There is no specific vaccine or treatment for the Bundibugyo Ebola strain behind the latest outbreak. Tedros said the WHO was supporting Uganda together with the Africa Centers for Disease Control and Prevention after CDC and other partners across the region. With continued collaboration, I am confident with this outbreak can be brought under control, he added. Ebola, which is spread through close contact and bodily fluids, has killed more than 15,000 people in Africa over the past 50 years. The WHO and Africa CDC launched a $518 million plan on Friday to battle the outbreak over the next 6 months. The epicenter of the current outbreak is the DRC northeastern Ituri province, a region that has difficulties. A hospital in the Ebola-hit region of Bunia in the Democratic Republic of Congo is overwhelmed by the huge number of patients. The Ilkilia Clinic is one of the many other hospitals in the region, seeing a huge surge of patients amid low supplies. We're overwhelmed because given the influx of patients, we have a lot of patients but nowhere to put them. We're in the process of getting organized, and we hope that in a short time, the center will be up and running and will be able to address these problems, said Yazin Yassan, the medical director of the El Kilia Clinic. The outbreak has hit 3 provinces, with the epicenter in Ituri, which the Africa CDC says accounts for 90% of confirmed cases and 76% of confirmed deaths. According to the WHO's latest figures, there are 381 confirmed cases in the DRC, including 64 deaths. The Ebola outbreak was declared on 15th May in northeastern DRC. Still, health authorities believe that the Bundibugyo strain of the virus, which is quite rare, had already been circulating under the radar for some time. Yes, managing it is complicated, but because we're in the rising phase, with new cases coming in all the time, the population itself hasn't yet accepted or agreed to do what's needed to eradicate this disease. That's how it is. We are in a phase where we're going to have a lot of patients, but measures are being put in place to address that, including communication and raising awareness. I hope that in a short time, we're going to eradicate this disease, said Yazid. Ebola, which is spread through close contact and bodily fluids, has killed more than 15,000 people in Africa over the past 50 years. That's all we have time for in this edition for News Around Africa by Magic TV, and I'm Esther Wilson.